Hi, thank you so much for stopping by the channel. My name is Palma and you're welcome to the channel. If you're new, thank you so much for stopping by the channel. Here we talk about everything. We talk about women health in general, the things you won't hear anywhere, you hear them here. So yeah, stick and stay and I'm sure you enjoy your stay. So today we are going to talk about early pregnancy symptoms and signs, right? The first 3 days to 7 days, or even the first, let's give it a wide range, the first 3 days to 14 days. Sometimes within this period, when you test at home, you may get a negative result, but then probably you may still be pregnant. So yeah, I'm going to give you some of the signs and symptoms that if you're experiencing and you've had unprotected sex and also your period is not coming or something, then probably you are pregnant. So let's just get, and yeah, acknowledging my Christmas something. We are still in the Christmas mood. Merry Christmas in advance. We are in December, so yeah, Merry Christmas. Christmas mood actually. Let's just get into the video. Alright, so pregnancy signs and symptoms vary from one person to the other, right? What I may experience when I'm pregnant may be different from what Sister A will experience when she is pregnant. I was going to say when she or he, but he doesn't get pregnant. So yeah, it varies widely among women. But then there are some common signs and symptoms that are common among women, like you may experience. A typical example is missed period. If you miss your period and you're not having any underlying disease or something, it may be anything else aside pregnancy, but then if you're not having any underlying and you've had unprotected sexual intercourse in the course of the month, then probably you are pregnant. So that is common among women, right? And for the first few days, when the fertilized egg is attaching itself to the uterine, I don't know how to mention this, uterine wall, uterine. I'll leave the spelling on the screen. Uterine wall. These are some of the things you may experience. So a typical one is implantation bleeding. When you talk of implantation bleeding, it's basically the fertilized egg attaching itself to the wall of the uterus, and you may think you are menstruating or it's your period that has come back. It does not. It is not your period. So it comes like your period, like you'll be flowing and all, but then the difference is this one, the blood, the flow may not be as heavy as your normal period, or it may not be as longer. If you menstruate for, let's say, 5 days, this may come like a day or two, maximum 3 days it has stopped, and it won't come like the way your period will come. You see, if your period is coming, everything is coming out, but this one is just the fertilized egg attaching itself to the wall of the uterus. So the few blood that is around that's what will come out, not really your period. So yeah, if you've experienced implantation bleeding, don't mistaken it for your period. That's not your period. That's not your period. It's just implantation bleeding. The next one is frequent urination. So frequent urination can be as a result of UTI, anything at all aside pregnancy. But then if you've missed your period, if you have other symptoms and you're also urinating frequently and you don't have any infection or anything, then it may be pregnancy. During pregnancy, or if you're pregnant, there are lots of hormonal changes that goes on. These hormonal changes can increase blood flow to the pelvic area, and it can even result in frequent urination. So yeah, frequent urination is also one of the common symptoms at the early stages of pregnancy. The next one is dizziness or headache. You may be feeling dizzy all of a sudden. You may be feeling like your head aches. I was coming to speak to you. Like you'll be experiencing this headache here and there, which is not usual of you. Your head will start aching rough, So yeah, if you're experiencing something like that, there's a lot of changes that goes on in your system to adapt to the new situation that is going to happen to it. So yeah, there will be change in blood pressure, which may even lead to the dizziness you are feeling or the headache you may be feeling. The next one is mild cramping. So you see the cramp you have when you are menstruating, right? You have this mild cramping. This is because the uterus is trying to expand to accommodate the baby. So you may experience this like little cramping here and there, you may think it's your period that is about. It is not your period that is about to come, bro. You've catch the case, like you've catch the case. I'm happy for you. If only you're expecting it, right? If you're not expecting it, then you have to expect it because stuff comes.
Yeah.
The next one is mood swings or change in mood. The least thing you're happy, the least thing you're sad, the least thing you're angry, you're pregnant. I'm not trying to scare you or anything. That's if only you are not expecting it. But then change, mood swings, mood change, and all that is a common example of the early signs of a common example of. I don't know if I'm speaking a good English, but it's one of the signs you may experience if you are pregnant within the first few days. The next one is constipation. Constipation. I'm sure you were not expecting this, but yeah, constipation. So if you've constipated for a period of time now, like all of a sudden, although you eat fruit, you eat well, you eat all the vegetables, but then you are constipating and all that, then bro, you may be pregnant. It's one of the early signs of pregnancy, constipation. This because like I said, a lot of hormonal changes are going on. There may be delay in your digestion may slow down a little bit and it may cause you to constipate a little bit, but then you will be fine. You are just pregnant. You will be fine. So another one is bloating, right? Bloating, like you feel bloated, you be passing out gas. You feel like there is gas in you, like you feel gas in your stomach, you feel bloated and all that. So yeah, if you've been feeling bloated and you feel like there's gas in your stomach, and also you've been passing out gas but meanwhile you're not lactose intolerant, that you're going to eat milk or you're going to eat egg or something that will cause you to pass out gas, or even when you are not any of those things. I think some people get gas, yeah, and even these you get gas, but you are not any of these and you're still bloating, bringing out gas and all, and you've done the do in the course of the month without protection, then you may be pregnant. The last one we want to talk about actually is two. I'll make it one. The last one we want to talk about is increased salivation. The amount of saliva you see in your mouth, like you feel in your mouth, becomes small. And some people start spitting out, and that's a bit nasty. I don't know how it will be for me when I get pregnant, but that's a bit nasty. They'll be throwing out saliva and all that. And also food aversion, I think food aversion, like you're able to perceive scent easily, you're able to perceive food scent easily, and you have different cravings, like you want to chew build. But people when they are pregnant, they want to chew buildings, they want to eat mud, they want to eat clay, they want to eat there's this thing, like everything they want to eat, and then the least things smell, the least scent they can smell. Hey, bro, if you're experiencing this, and although you took a test and it's negative, but then you are still experiencing, so during the first few days or the first few weeks, mostly between 3 to 14 days, the first 3 to 14 days, when you do a pregnancy test, likely there's a possibility that you may see a negative result, but then bro, you may still be pregnant. So just give it some time. But then if you've experienced all the things I've mentioned, right? If you experience bloating, constipation, food aversion, increased salivation, mouth cramping, fatigue, like the least thing you do, you are tired, and like a lot all the things I've mentioned, if you're experiencing all these and then you are not sick, you don't have any infection, so these symptoms or these signs may be related to any other thing aside pregnancy. This can be signs of any other infection or any other sickness or something. So yeah, the best thing to do if you think you're pregnant is to take a pregnancy test. If you take the pregnancy test and it comes out negative and you are experiencing all this and you are close to a hospital, the best thing will be to seek a medical advice. But then if you are not, or you don't have the means to go to a hospital at that particular moment, I would say give yourself like a week or two and test again. Maybe there's this thing HCF, is it HCF? hormonal something that is supposed to be in the urine for you to test to get the positive result is not enough yet in the urine. And also you have to use your morning urine. So if it's not enough in the urine, you may get a negative result, although you may be pregnant. So yeah, just give it some time and test again, and let me know in the comment section a common early pregnancy sign or symptoms you know, or you know somebody who has experienced it, or you yourself has experienced it before, and let us know in the comment section. Educate us in the comment section. Thank you so much for stopping by the channel once again. In our next video, what should we talk about? So I feel sex is a topic people are so hypocritical about. They don't talk about it, but bro, you are not innocent, so I think we should talk about something related to sex. That's what we do. Yeah, so subscribe to the channel, turn on your post notifications so that the moment I upload the next video you will see it. And thank you so much once again for stopping by the channel. My name is Kalma. I was coming to say thank you again, but thank you. I'll see you in the next video. Peace out. Mwah.